Hi everyone, here I am giving some brief introduction to forensic medicine, which might be helpful for you. And what is forensic medicine? Is application of medical knowledge to aid in the administration of justice. It's called as forensic medicine, also known as legal medicine. And what is medical jurisprudence? Is legal responsibilities of a physician with reference to those arising from physician-patient relationship. That is medical jurisprudence, and medical ethics is moral principles which should guide the members of the medical profession. This is medical ethics. Medical etiquette is conventional laws of courtesy observed between the members of medical profession. That means I am a doctor. If I got some illness of my ear, I have to consult an ENT doctor. So I'll go to ENT physician, and usually if a normal person goes, he will charge something. And if I goes, what he has to do is he don't have to charge any fee for me because I'm a doctor and he's also a doctor. So that is called, he don't charge the fees for me. That is called medical etiquette. And here you have to remove some names of some previous old scientists. Of those, first is D. Varignana, who did his first autopsy, and first autopsy is done by D. Varignana. And next is Paracelsus, who is the father of legal medicine and forensic psychiatry. He also contributed a book that is Questions Medico Legales, and it is also written by Paracelsus. So he is the father of legal medicine and father of forensic psychiatry. And next is Orfila, who is founder of modern toxicology, father of modern toxicology, or founder of modern toxicology is Orfila, whereas Paracelsus is father of legal medicine and forensic psychiatry. And now we will go to IPC and CRPC. What is IPC? IPC is Indian Penal Code, which defines the offences and even prescribes the punishments for those offences. That is Indian Penal Code. Next is CRPC. CRPC means Criminal Procedure Code. What CRPCs do is they provide mechanism for punishment of offences. Mechanism for punishment is given by CRPC, where punishment, definition of punishment is given by Indian Penal Code, that is IPC. So you have to remember these 2 points from there. And one more is Indian Evidence Act. I didn't mention here. Indian Evidence Act categorizes the evidences and even preservation of the evidences, collection of the evidences. These things are done by Indian Evidence Act. That is IPC and CRPC and the Indian Evidence Act. Next is civil law and criminal law. What is civil law? Civil law is observed between two individuals or two parties. That is, if a fight or something happened between two individuals, that will go to civil. That is a civil case. And criminal cases, if someone done any offense against the public interest, that will come under criminal case. Criminal case such as murders and bank robberies. There are so many things and comes under criminal cases. Whereas civil is between two bodies or between two individuals is civil. Now you have to remember two definitions, that is plaintiff and defendant. Plaintiff is the party who bringing the action, or a person who bringing the action is called as plaintiff, whereas the defendant is accused in cases. That is, accused person is the defendant. He has to defend himself, so he is called as defendant. And cognizable offense. Cognizable offense are those offenses in which a police officer can directly arrest a person without any warrant from the magistrate. Usually, if you want to arrest a person, what the police should do is he has to get some warrant from the magistrate to arrest that person. But in these cases or in these offences, a police officer do not need any kind of warrant from magistrate. He can go directly and arrest that person. Those offences are called as cognizable offences. The examples of cognizable offences are rape, murder, dowry death, and even dragging and even negligence. So these will come under cognizable offences: rape, murder, dowry death, ragging, and negligence. And side, which is inquest. What is an inquest? Inquest is inquiry or investigation into the cause of death. Inquiry or investigation into cause of death is called as inquest. Inquest or inquiry can be done in cases of unnatural death, such as suicide, homicide, or accidents, or occupational death, or deaths due to medical negligence, and animal attacks or suspicious deaths. So, any unnatural deaths, what we will do is we will inquire or we will investigate the case how the death has happened. So, this is called inquest. There are two such inquests. One is police inquest and another is magistrate inquest. Police inquest comes under 174 CRPC. Usually SI will conduct the inquest, or SI or some inspector also can do the inquest in presence of two or more respected persons, which are called as panchas, and prepares the inquest report, that is panchanama. What is panchanama? Is the inquest report, nothing else. So that is police inquest. You have to remember here is 174 CRPC. 174 CRPC is for police inquest, and for magistrate inquest it is section 20 to 23 CRPC. I have mentioned here magistrate inquest can be done in some cases such as death in police custody, or death due to police firing, or death in prisons, or deaths in psychiatric hospitals, dowry deaths, and even exhumation. Exhumation, I will give some points of some time. And this magistrate inquest, in any case of death, a magistrate can conduct an inquest instead of or in addition to police inquest. So, in any case of death, a magistrate can conduct an inquest. But in these cases, I will tell you now, magistrate inquest is a must. That is, death in police custody, or death due to police firing, or death in prisons, or in reformatories, or death in psychiatric hospitals, or dowry deaths, and even exhumation. In these cases, magistrate inquest is must. And what is exhumation? Exhumation is digging out of a buried body. Exhumation can be done in if there is a suspicion, or if you want to do autopsy again. Suspected cases, usually we will do exhumation in suspected cases. What we will do is we will bury out the body. Sorry, we will dig out the body which is buried, and if needed, we will do send it for autopsy. So that is exhumation. I will tell some points later also about this exhumation. And next is coroner's court. Just remember one point: coroner court is a court of inquiry, not a court of trial. Just remember this point from coroner's court. That will be enough for now. And here I am going to give some different kinds of courts and the punishment given by them, and even the fine awarded by them. Second class magistrate, first class magistrate, chief judicial magistrate, assistant sessions court, high court, supreme court. Second class magistrate can give an imprisonment, that means jail, for 1 year and a fine of rupees 5,000 rupees. And a first class magistrate, up to 3 years imprisonment can be given, and a fine of rupees 10,000 rupees. and chief judicial magistrate can give an imprisonment up to 7 years, and the fine is any amount that he want. And assistant sessions court, imprisonment up to 10 years and any amount of fine he want. Sessions court, any sentence authorized by law and any amount of fine. And even High Court and Supreme Court the same, any sentence can be awarded. But here you have to remember one thing about Sessions Court. What the Sessions Court do is, Sessions Court can announce death sentence. That means he can award death to the offender. But the death sentence must be confirmed by High Court. So Sessions Court can give an death sentence, but it should be confirmed by High Court. And other than that, High Court and Supreme Court can award any sentence and any amount of fine they they want. High Court and Supreme Court do not hear the trials. That means, one minute. High Court and Supreme Court only hear the referrals, that is referred by the previous courts, but not the trials. Trial means direct case. They don't take the direct case, but they only take the referrals. So that is about the courts and their imprisonment and fine. Come to next slide. Juvenile magistrate. Juveniles are boys under 16 years of age and girls under 18 years of age are considered as juveniles. Juvenile Magistrate Board, in this one, Metropolitan Magistrate or a first class judicial magistrate are present, and even two social workers. Out of those two, at least one woman should be there. So just you have to remember these years. Boys less than 16 years and girls less than 18 years are considered as juveniles. Metropolitan Magistrate or First Class Magistrate is present in the Juvenile Justice Board along with two social workers. Out of those, at least one woman should present. And medical evidence. Now the medical evidence may be documentary or oral or direct evidence, indirect evidence or hearsay. Documentary evidence is written evidence, that's medical certificates, medical legal reports or dying declarations. These will come under documentary evidence, whereas oral evidence, by oral, here the oral evidence is superior to any other evidence because both is administered and cross-examination is done. So oral evidence is superior. Just remember this point. Oral evidence is superior, and direct, indirect evidence. Direct evidence is evidence of a person who have been seen or heard or perceived the fact. Indirect evidence or circumstantial, that is hearsay. Indirect or hearsay are the both are the same. In this, witness states that he has heard others saying. He has heard others saying. Other two persons are discussing about this case, but he heard from others that it has happened. So that is called hearsay. Direct evidence is the person is present or seen the crime. That is called direct evidence. Whereas indirect is he has heard from someone discussing the topic. So that is called indirect evidence. Oral documentary we already had, but oral is superior. Just remember this point. Oral evidence is superior to all these. And hostile witness. Hostile witness is who conceals a part of the truth. That is, he don't tell exactly what happened there. He might conceal some part of the truth, or he might add something else into the truth, what has happened there. He is called as hostile witness. Hostile witness comes under section 191 IPC, which is very important. Here I have mentioned two IPCs, that is for hostile witness and one for perjury. Hostile witness, it is 191 IPC, and perjury is 193 IPC. Perjury is giving false evidence. Will give false evidence, that is called as perjury. Just remember this 193 IPC from perjury. And hostile witness who conceals a part of the truth or completely gives a wrong statement, that is called hostile witness and perjury. Just remember the IPCs which are important in this slide. We are going to next slide. Oath. Just remember one point, that is child below 12 years of age are not required to take an oath. And now direct examination, cross examination, re-examination, and examination by judge. Direct examination is or also called as examination in chief. In this direct examination, no leading questions are asked, whereas in cross examination, leading questions are asked to elicit the facts that the question that the witness is telling the truth or not. That is cross examination. Next is re-examination. Just remember, in re-examination also there are no leading questions are asked. And examination by judge. Judge can ask any question at any time. Just remember this point in examination by judge. Next is dying declaration. What is dying declaration? Dying declaration comes under section 32 IEA, that is Indian Evidence Act. Dying declaration is done when the suppose a person is in serious condition. We can take a dying declaration from him. A magistrate can conduct an inquest. In dying declaration, no leading questions are asked and no oath is administered. Here some spelling mistake is there. Let's correct it. No leading questions are asked and no oath is administered in dying declaration, and it has corroborative value when the person survives. If the person survives, the dying declaration which we have taken had some corroborative value, which will add some evidence to the truth what he is telling. So if the person survives, it is also helpful. No police officer should present at the scene while taking the dying declaration. Anyone can take dying declaration if there is no time for the judge or for the magistrate to come to the scene. In that case, anyone can do this, but in the presence of uh, two two persons, so anyone can take the dying declaration when there is no time for the judge to or for the magistrate to come to the scene. So these are some important points regarding dying declaration. And next is dying deposition, which is not followed in India. In dying deposition, oath is administered and cross-examination is done. So that's why this is not followed in India, because of some ethical values. But dying deposition is superior to dying declaration, but not followed. Just remember, oath is administered and cross-examination is. Now, Indian Medical Council and State Medical Council. Functions of Indian Medical Council: it maintains the medical register, maintains the standards of medical education, recognition of foreign medical qualifications, and appeals against disciplinary action, warning notice, list of practices which are considered as professional misconduct. So, warning notice, disciplinary action, educational standards, maintenance of medical register, recognition of foreign medical qualifications. And what are the functions of state medical council? The same: maintain medical register, maintain education standards, but penal erasure and disciplinary action. What is penal erasure? Penal erasure or professional death sentence is the removal of name of the doctor from the medical register. Main cause is serious professional misconduct or infamous conduct done by a doctor. In those cases, the state medical council removes the name of the doctor from the register. That is called as penal erasure or professional death sentence. If the doctor has done some serious professional misconduct or infamous conduct, he is removed by the state medical council. Just remember this point, which is important: penal erasure done by state medical council. Several times asked in examinations. And next is dichotomy. Dichotomy is called fee splitting. Just remember this: dichotomy is fee splitting. If I want to tell you some example, like some pharmacies or some other surgical materials, they will offer some money or some gifts to the doctor if he allows their products to sell. So that is dichotomy, fee splitting. Next is adultery, is sexual intercourse other than with spouse. That is adultery. Voluntary sexual intercourse with a person other than his or her spouse. Covering is if doctor is not present, and if there is any case in the hospital, what he will do is he will ask some other person who is not qualified to do that procedure. That is covering. It is called as covering. Even that is a negligent act by a doctor. And professional misconduct. There are 6 years of professional misconduct that are adultery, abortion, association, advertising, addiction, and alcohol. These 6 years are considered as professional misconduct. Doing abortion or adultery or association with some other person, and advertising and addiction and even alcohol consumption. These will come under professional misconduct. Alcohol consumption, what he will do is he will drink and go to the OT or some go to IP, OP. That is called what he is doing is called as a misconduct, professional misconduct. Criminal negligence, contributing negligence, medical maloccurrence. Criminal negligence is gross absence of skill or lack of skills is called as criminal negligence. That means some examples like amputation of wrong finger. He has to cut, he has to amputate the second finger of the right hand, but if he amputates the left hand's finger, that is that will come under criminal negligence. And even leaving instruments or leaving swabs in the abdomen and doing suturing, so this will come under criminal negligence. You will be seeing this scene in many movies, like he doctor will leave some instruments in the abdomen of other patient, so that will come under criminal negligence. And contributor negligence, along with the negligence of the doctor, if a patient or patient's guardian is negligent, it is called as contributory negligence. Patient or his attendant is also negligent by non-cooperating with the doctor. So this will come under contributory negligence. Next is medical maloccurrence. Medical maloccurrence, also called as act of God. In spite of good medical attention and care, in some cases an individual fails to respond properly or may suffer from adverse reactions of the drug. That is called medical malpractice or act of God. The doctor has good knowledge and he gave good proper care to the patient, but even though there are some adverse reactions of the drug which are not controlled by the doctor, that is called as medical malpractice. Examples are like breaking of needle during intramuscular injection due to sudden muscular spasm. This sudden muscular spasm and the injection has been broken. The doctor can't do anything in that case. He can't control that muscular spasm, right? So, sudden muscular spasm, injection and needle is broken. It will come under act of God or medical malpractice. And damage to RLN, recurrent laryngeal nerve, which is commonly damaged during thyroidectomy. So in that case also doctor can't do anything. Even he is having some good care, even he is having some good skills of operating, but RLN is most commonly damaged during thyroidectomy. In this case also doctor can't do anything, and this is called medical malpractice or act of God. Offenses against negligence are maintaining proper skills and existing treating the patient according to the existing standards of the profession, and contributor negligence. If the patient along with our patient's attender is also negligent, then doctor can defend the negligence. And intervention of third person with the doctor unknowingly, that means doctors don't know that third person intervened in between and the case has spoiled. In that case also doctor can defend himself. And therapeutic misadventure, that is unintentional therapeutic misadventure, that is unintentional act by doctor, such as hypersensitive reaction or anaphylactic reaction by penicillins or aspirins. And another is medical malacquerence. I have told you just before about medical malacquerence. Contributory negligence is not a defense against criminal negligence. If he did some criminal negligence, he is criminally sorry. Contributor negligence is not a defense against criminal negligence. Just remember this point. Paternalism is abuse of medical knowledge. Vicarious liability is employer is responsible for the act of employees. That is, if I appointed some three other persons as my assistants or some other persons, that in that case I am responsible for what they did. So that is called as vicarious liability. And paternalism is abuse of medical knowledge to distort the doctor patient relationship. So that is paternalism. Medical records, inpatient records should be maintained for at least 3 years of duration. And if you think there is some rise of medical issues, like some if there is rise of negligent act by doctor, if they rise something against you, then in those cases, if you think there is a chance to rise the negligence act, in this case you have to preserve those records for 25 years, and MLC records should be preserved for 10 years. Medical legal cases, those records should be maintained for 10 years, and after the death of the patient, the records should be at least maintained for 3 years. So these are various time durations of maintaining records. And the consent. Consent means voluntary agreement or permission. It is given by patient. So voluntarily agreeing for the procedures you are doing. So that is called as consent. Two types: implied consent and expressed consent. Expressed consent is whether it is written or verbal. Implied consent means you are going to give an injection to the patient, and he automatically gives his hand. So that is called implied consent. That is he is implementing. That is he is the patient on his own is giving his hand to you by seeing injection in your hand. So that is called as implied consent, whereas expressed is whether written or verbal. Next is oral consent, written consent, blanket consent. Blanket consent is taken at the time of admission for all the procedures. That is blanket consent is for all the procedures at a time. But blanket consent is not a valid consent. Oral and written are valid, and loco parentis. What is loco parentis? Is a child under 12 years cannot give a valid consent. That's why if a child is staying in some hostel or some school, so at that time the parents are not available. So if he is having some injury or some having some serious condition, he is transferred to some local hospital and the doctor will see and he has to treat. Further, the doctor asks him for consent, but a child under 12 years cannot give a valid consent. So what in this case, what they will do is the in charge person of the child, that is in charge of the child at that time, that is the school headmaster or the school teacher, he can give valid consent to treat that child who is under 12 years of age. So this is called loco parentis, and blanket consent for all the procedures, but it is not valid written and oral consent. Acts: Human Organ Transplantation Act, Workmen Compensation Act, Protection of Human Rights Act, Consumer Protection Act. Human Organ Transplantation Act is made in 1994, Workmen Compensation Act 1923, Protection of Human Rights Act 1993, Consumer Protection Act 1986. Let's remember some points from Human Organ Transplantation Act. Remember one point from Human Organ Transplantation Act or the Transplantation of Human Organs Act. Both are the same. Just remember this point: bone marrow transplant is outside the purview of this act. Bone marrow transplantation do not come under this act because according to this act it defines a human organ as any part of the body consisting of structured arrangement of tissues which is wholly removed, cannot be replicated. Any part of the human body consisting of structured arrangement of tissues which is wholly removed, cannot be replicated. But what will happen with the bone marrow is after removing some part of the bone marrow, even after that bone marrow can replicate. So that's why bone marrow transplantation cannot come under this act. Now euthanasia. Euthanasia is mercy killing or assisted suicide. I think you had heard this word before. Mercy killing or assisted suicide. It is not an assisted homicide. Remember, it is assisted suicide. It is of four types: active euthanasia, passive euthanasia, voluntary, and involuntary. Active euthanasia is act of commission. That is, you are giving some large dose of drug to, yeah, what you are doing is you are giving some large amount of drug in active euthanasia. That is, you are committing that, so it is called as act of commission. You are giving large dose of drug to hasten the death. So you are giving, so it is act of commission. You are committing. Next is passive euthanasia, or also called as negative euthanasia, which is act of omission. That is, no specific medicine or life-supporting measures are given. Death induced by discontinuation of life-sustaining measures. That is, if some patient is on ventilator, you are disconnecting the ventilator so that you are hastening the death. So it is act of omission. You are omitting it. That is, you are stopping that ventilator, you are removing that ventilator, so that's why you are hastening the death of the patient. This is called as passive euthanasia. That here you are not giving any drug to the patient. In active euthanasia, you are giving some drug to the patient to hasten the death. Next is voluntary euthanasia. Voluntary euthanasia maybe senile people or patients suffering from incurable disease or due to senility. What they will ask is they will ask the doctor to terminate their life. That is called voluntary euthanasia. And involuntary euthanasia. Involuntary euthanasia is done when the patients are unable to express their wishes. That is, a person with irreversible coma or severely defective infant. In those cases, they can't express their wishes, so it is done by their relatives, patient's relatives. So it is involuntary euthanasia. Autopsy. I think you are well known about this word. Clinical autopsy, medical legal autopsy, virtual autopsy, psychological autopsy. Clinical autopsy or pathological autopsy. In this, you must need the consent from the relatives of the patient. So, a consent from the relatives is must needed for clinical or pathological autopsy. In medical legal autopsy, consent from relatives is not necessary. You can directly do autopsy without the permission from the relatives. Next is virtual autopsy, also called as autopsy, is done with the help of CT or MRI. So it is called as autopsy or virtual autopsy. Next is psychological autopsy, which is different from the first three things. The psychological autopsy is a procedure for investigating a person's death by reconstructing what the person thought or felt or did before the death. So it is by analyzing, you will ask his friends or his relatives or his neighborhoods what has happened before the time of death. So that is psychological autopsy. You are estimating the psychological potential of that person. So it is called as psychological autopsy. It will help you to give the reasons of his death. Techniques of autopsy, Virchow's techniques, Rogatansky technique, Lutelis technique, and Gauss technique. Virchow's technique, I think, is the most common type of autopsy done, and Rogatansky technique. In Rogatansky technique, in situ dissection is done. In situ dissection is done in Rogatansky technique. Lutelis, in Lutelis, all attachments are intact. Just to remember these 2 points. In situ dissection done in Rogatansky, and all attachments are intact in Lutelis technique. And another is Gauss technique. In Gauss technique, all the organs are removed in organ blocks. Organ blocks. So next is air embolism. In air embolism, head should be opened first, and the surface vessels of the brain are examined for gas bubbles. And next point is left ventricle is filled with froth if air is present in sufficient amount to cause the death. So these 2 points are important. Head should be opened first in air embolism, and left ventricle is filled with froth in air embolism. Just remember, they will ask left ventricle, right atrium, left atrium. So you have to go for left ventricle. And next is parogalal test. Air is brought in contact with alkaline parogalal solution, which turns brown, indicates antemortem air embolism. It is to detect whether it is antemortem air embolism or postmortem air embolism. In antemortem air embolism, the parogalal, which turns into brown on exposed to air, that is gas bubbles. So which is a important test. And the next is some obscure autopsy and negative autopsy. Obscure autopsy means if there are minimal or indefinite or obscure findings, it is called as obscure autopsy. Negative autopsy is when you grossly examine the when you closely examine the dead body, and even though you can't find any reason why the patient is dead or what is the reason for the death, that is called as negative autopsy. Whether obscure autopsy is when there are obscure findings or minimal findings is called as obscure autopsy. Artifacts. What are artifacts? Artifact is any change caused or feature introduced in a body after death. That is, any change caused in a body after death is called as artifact. Economic artifact, that is regurgitation or esophageal gastromalacia, and even artifacts during resuscitation. Injuries due to defibrillator application or cardiac massage or central line or positive pressure ventilation or laryngoscope. These will come under resuscitation artifacts as these artifacts are introduced during resuscitation, so called resuscitation artifacts. Secondary artifacts are regurgitation and esophageal gastromalacia. Even I don't know exactly about these secondary artifacts. And the artifacts due to handling of the body. During the handling of the body, undertaker's fracture, postmortem operations, which come under handling during handling of the body, artifacts during handling of the body, and burns. Heat rupture or heat hematoma will come under burns artifacts. And during autopsy, that is skull fracture, visceral damage, and head bone fracture. Head bone fracture, skull fracture will come under during autopsy artifacts. So if there is any mistake, you can please correct it and tell me back. So thank you very much. Here I am giving brief discussion on postmortem changes. Thanatology is study of death, and forensic taphonomy is study of post-mortem processes of human remains. That is, what happened to the organs of the body after the death. So that is forensic taphonomy and thanatology. Next is Minnesota criteria. What is Minnesota criteria? It is a criteria for brain death given by Mohandas and Cho. And the criteria is as follows: there should be known but irreparable intracranial relation, no spontaneous movement, apnea, that means absence of respiration at least for a period of 4 minutes, and there should be absence of brainstem reflexes such as corneal reflex and gag reflex, ciliospinal reflex. So this should be absent. EEG is not mandatory in Minnesota criteria. So this criteria is for brain death. Next is Harvard criteria. In Harvard criteria, along with the above things, there should be EEG. The isoelectric EEG is a mandatory to confirm brain death. Suspended animation, also called as apparent death. In this condition, a person is supposed to be dead but he is alive. That means the functions of the body, the functions of the organs are minimized to such a level which will appear as a death. This is called suspended animation. It is voluntarily produced by some yoga practitioners. It is also seen in cases of freezing, severe drug poisoning, newborns, drowning, electrocution, sunstroke, shock, hypothermia, cerebral concussion, cholera, and insanity. In these cases, suspended animation can be seen. Postmortem changes. There are three categories in this. One is immediate changes, early changes, and late changes. Immediate changes occur immediately after death. Early changes within few hours of the death, and late changes take some months. Cessation of brain function, cessation of respiration, cessation of circulation, and primary flaccidity of muscles. Cessation means stoppage. Stoppage of brain function, stoppage of respiration and circulation. So these will come under immediate changes. Next is early changes. Skin changes, eye changes, alga motis, liver motis, rega motis. I will describe these things later. Uh, Next is late changes, putrefaction, mummification, and adiposity. These will come under late. Changes in the eye. First, the cornea. The cornea will become wrinkled and it will become dry, cloudy, opaque, and hazy. Tachynoid. What is tachynoid is due to accumulation of cell debris and mucus on either side of the cornea will form two triangles. This is called as tachynoid. It will happen only if the eyeballs are kept open after the death. So that is trichinoid. It will happen only if the eyeballs are kept open after the death. It is due to accumulation of debris and mucus on either side of the cornea. And this will form two triangles. So that is trichinoid. And there should be loss of corneal reflexes and light reflex is abolished. Eyeball become flaccid due to fallen intraocular pressure. Intraocular pressure falls to zero within 2 hours of the death. This is very important. And segmentation of blood columns is observed in retinal vessels when seen over ophthalmoscope. This is called Kevorkian sign. Kevorkian sign is segmentation of blood columns in retinal vessels when observed over ophthalmoscope. And there is increase in potassium concentration in vitreous. Alga motis. Alga motis is cooling of the body. After the death, the body will become cool. This is because there is imbalance between heat production and heat loss. Loss of heat of body by means of conduction, convection and radiation till it balances with the temperature of surroundings. So this is the postmortem cooling, also called as Algar motis. Rate of cooling in first hour is much more than the remaining hours. So the rate of cooling is fast during first few hours and later it will slow down. In first hour, the rate of cooling is 2 to 3 degrees centigrade per hour, and after that, 1 to 1.5 degrees centigrade per hour in next hours. That means after 1 hour, the rate is 1 to 1.5 degrees centigrade per hour. So this rate of cooling depends on various conditions such as the age, condition of the body, mode of condition of the body means the weight of the body, mode of death, surroundings, environmental temperature, weight, weight of the body. More body weight. If there is more body weight, the rate of cooling is slower because of superficial fat. There is so much fat in the body, so that rate of cooling is lower than that of the normal. So surroundings. If the surrounding temperature is cool, the rate of cooling of the body is very fast. That means in cold climates, the rate of cooling is much faster than the normal, and in warm climates it is lower. And environmental temperature is the same. Postmortem caloricity. Till now we discussed that there is cooling of the body after death, but in some cases there is rise in temperature after death. So that is called postmortem caloricity, which means rise in body temperature after death rather than cooling. It is observed in cases such as sunstroke, spontaneous hemorrhage. If the patient suffered with sunstroke or spontaneous hemorrhage before he died, there will be postmortem caloricity, that means increase in body temperature even The same with the tetanus and strychnine poisoning and acute bacterial or viral infection, septicemia, lobar pneumonia, and typhoid fever, encephalitis, and even in case of asphyxial conditions, it is observed. Postmortem lividity, that means staining, also called as postmortem hypostasis, suggelation, vibices, liver motis. It means discoloration or staining of the skin and organs after death due to accumulation of fluid blood in the dependent parts of the body. As due to accumulation of blood in dependent parts that will stain the body. This is called as postmortem lividity, also called as hypostasis or suggelation vibicis liver motis. It starts in 1 to 3 hours and become fixed after 6 to 8 hours. Fixed means it won't alter in position. Even if you change the position of the body, the staining will do not alter in position. That is called fixed hypostasis. It will observe only after 6 to 8 hours of the death. Development of flaccidity, fixation of lividity in 6 to 8 hours, site of distribution on dependent parts, extent. It is a reliable sign of death. It gives the information about the position of the body at the time of death. Time since death can be estimated. You can demonstrate the position of the body at the time of the death. That means whether it is supine or vertical. You can demonstrate. Distribution of lividity may be give you the information about manner of death. Depending upon the position, in supine position, the staining, the coloring is observed over shoulder blades and buttocks and calves. It is in supine position, and in vertical position, glove and stocking hypostasis. That means in vertical position, such as in cases of hanging, the hypostasis is that is staining is observed in hands, arms, and foot and legs. This is called glove and stocking hypostasis. And in case of drowning, it is observed over face, upper limbs, and abdomen. So here are various examples in different cases of poisonings and different colors. So in carbon monoxide poisoning, cherry red colored staining is observed over the body, and in hydrocyanide poisoning, it is bright red. In poisoning with nitrates, nitrobenzene, aniline, potassium chlorate, it is reddish brown. In potassium cyanide poisoning, it is deep blue. In Clostridium perfringens, it is bronze color. In hypothermia, it is bright pink. And in opium poisoning, it is black color. It is very important slide. This is so here I gave some picture of carbon monoxide poisoning in which cherry red colored stain observed over the body. You can see the cherry red color staining. This happened in carbon monoxide poisoning. Cadaveric rigidity, also called as rigor mortis. This means after death the body will become stiff and rigid. The body will become stiff and rigid after death. This is due to fall in ATP levels. The ATP levels falls to if the ATP levels falls to 85% of the normal, the body starts to become stiff. And if the ATP levels falls to 15%, 15% of normal, the rigidity is maximum. First involuntary muscle to be affected here is myocardium, and the voluntary muscles eyelids, face, jaw, thorax, abdomen, fingers, and toe. This order of development of cadaveric rigidity. This is due to fall in ATP levels. The body will become rigid and stiff. In temperate climates, last for 2 to 3 days. And here is there is a rule that Niston rule. I didn't mention here. Niston rule means it starts in first 12 hours and then maintained for 12 hours and passes off after 12 hours. So this is rule of 12, also called as Niston rule. In diseases like cholera, plague, typhoid, TB and cancer, the onset of rigor is early and it disappears soon. In diseases like pneumonia, asphyxia, nervous conditions such as paralysis, onset is delayed. In dry and cold air, onset is slow and it lasts for a long time. Here I gave you three conditions which mimics, that means which are similar to cadaveric spasm, which are similar to rigor mortis. These conditions are heat stiffening, cold stiffening, and gas stiffening. Heat stiffening observed in case of burns, cold stiffening in case of tropical regions, and gas stiffening. And here is another condition which is called as cadaveric spasm, which is also similar to rigor mortis. Which is also a cadaveric spasm mimics like rigor mortis, but it's different from rigor mortis. It is also called as instantaneous rigor or cataleptic rigidity or death clutch. It happens immediately after death, but whereas rigidity, cadaveric rigidity happens, it takes some time to develop, but cadaveric spasm happens immediately after death. Only few groups of muscles are involved, but in rigor mortis, all the muscles are involved. That is, both voluntary and involuntary muscles of the body are involved in rigor mortis, but in cadaveric spasm, there are only few groups of muscles are involved. It is associated with emotional disturbance at the time of death, mostly seen in cases of suicides. Examples are drowning, suicidal gunshot, or suicidal cutthroat. Body temperature is warm. Examples are drowning, suicidal gunshot, suicidal cutthroat. What happens in these cases is he will hold the gun firmly before death. He will go hold the gun firmly, and after the attempt of suicide, the gun is firmly holded in the hand. I will give you a picture later that will show how it will happen. Here is the picture. First one is in case of drowning and second one in case of a suicidal cutthroat. So here is something. He grasped some weed and mud. In case of this has happened in drowning, so he is in water. He is grabbing some weed and mud, but finally he died. So this weed and mud is firmly grasped in the hand, and it will remain like that only, and the hand will not get relaxed. So this is clutch, death clutch, and in this case, blade is holded by the hand. So there is some emotional disturbance at the time of death. So these muscle groups, the muscle groups in the hand, are involved in this case. Now decomposition of the body. First is autolysis. Autolysis is self-digestion. It is because of cell organelles called lysosomes. They will release some enzymes, hydrolases, which are responsible for autolysis. And the first external sign of autolysis is whitish cloudy appearance of cornea. This is the first external sign of autolysis. Next is putrefaction. Clostridium welchii is responsible for putrefaction, is the main agent for putrefaction. It will release an enzyme lecithinase which will cause hemolysis. So lecithinase is the key enzyme in putrefaction. Hydrolases are key enzymes in autolysis. First external sign of putrefaction is greenish discoloration over cecum. It is the external sign, that is we can see it from outside. So greenish discoloration over cecum region. And first internal sign, that means if we open the body, the first internal sign is discoloration under surface of liver. So that is the first internal sign. The first external sign is greenish discoloration over cecum. This discoloration is because of hemoglobin is converted to self-methyl after the death. This conversion which will give in discoloration. Marbling of skin. It is greenish pattern on skin resembling branches of tree. I will give you a picture later. This is due to staining of superficial vessels with sulfur-methemoglobin. The hemoglobin is converted into sulfur-methemoglobin, which is responsible for discoloration. And this, if the discoloration in superficial layers of the skin, it will resemble like a branches of tree. That is called marbling of skin. And blisters starts to develop 18 to 24 hours after death, and maggots 1 to 2 days. Uterus and anus prolapse in 3 days after death. Skull suture suppression in children. In infants takes 4 to 5 days, and liquefaction of tissues takes 5 to 10 days. There is one more thing, postmortem luminescence. That means the body will appear bright. This is because of infection with Photobacterium fischeri, which is a bacteria, and Armillaria milia, which is a fungi. So postmortem luminescence, which is brightening of the dead body, this due to Photobacterium fischeri and Armillaria milia. It will appear like bright. And the order of putrefaction first starts in larynx, trachea, then to liver, brain, heart, prostate, and uterus. So putrefaction first starts in larynx, trachea, and last to putrefy is prostate and uterus. And overall, virgin uterus is the last to putrefy. So if they ask you a question like which is the last organ to putrefy, if there is option like virgin uterus, you have to go for the option. Otherwise, prostate. So this is marbling. It is looks like branches of tree. These are the superficial veins which are stained with sulfur-methemoglobin. Rapid putrefaction and delayed putrefaction. Putrefaction is rapid if the person is suffered with peritonitis, sepsis, or asphyxia, or clostridial infections, and even in abortion. In these cases, putrefaction is rapid. It is delayed. Delayed putrefaction seen in case of anemia, severe hemorrhage, wasting such as paralytic disorders, and carbolic acid poisoning, strychnine poisoning, arsenic and zinc chloride poisoning. These poisonings are very important. In these poisonings, the putrefaction is delayed. Mummification is a modification of putrefaction. It will occur in dry and hot climates. Dehydration and desiccation of the body. That what total water content of the body will evaporate. The body will shrink. The skin will become adherent to the bones. Here in this picture you can observe that the skin will become dark and it will become tightly adhered to the skeleton, that is tightly adhered to the bones. It will take 3 to 6 months to develop. The mummified body is odorless. Prerequisites for development of mummification: there should be no moisture in the air, that is absence of moisture in the air, dry and warm air currents. Chronic arsenic and antimony poisoning favors mummification, which is very important. Chronic arsenic and antimony poisoning favors mummification. Face is distorted and the skin will become dark. The skin will become tightly adherent to the skeleton. Wounds and tattoo marks are preserved in mummification. This is very important. Wounds and tattoo marks are preserved, but face is distorted. Adipocere is another modification of putrefaction which will occur in moist conditions, such as if the body is immersed in water or damp, it will become saponified. The essentials are bacterial fat splitting enzymes such as lecithinase. And saponification is due to hydrolyzation of fatty tissue into fatty acids, and the body will become yellowish white, greasy wax with rancid smell. It forms at any site where fatty tissue is abundant. The examples such as breast, thighs, and even over face. Time required for saponification. In summer it takes 3 weeks, or in tropics it takes 5 to 15 days. Prerequisites for saponification are abundant body fat, moisture, warm temperature, and bacteria like Clostridium welchii. These are the prerequisites, and here is the picture of saponification. It is mainly observed over face and breast area. Here, one important thing is the face is facial features are preserved. That is, you can identify the body with the by seeing the face, but in mummification you cannot do that. Here, facial features are preserved, and wounds and tattoo marks are also preserved in case of saponification. In mummification, wounds and tattoo marks are preserved, but facial features are not preserved. So that will help in identification of the person. Thank you.